Thanks everyone for joining us today. So we think, we spoke a lot about employees, digital transformation, what we can do to, make employees grow within organizations. But, one of the central pieces of HR is to take care of your employees' health, and which means that, the benefits that you design for your employees, have to, stay ahead of time and have to be very laser focused on your employees needs. So you can't afford to get left behind in terms of the benefits you are offering for your employees. So that's the topic of my presentation. How employee benefits are evolving and how health tech platforms are playing a key role in this evolution. So I'll just quickly start with, what are the current benefits that most corporates or MSMEs offer. So you would typically have a group mediclaim insurance, you would typically have a group personal accident insurance, a GTL policy or a top-up policy or a parental cover policy. That's what you offer, or that's what most corporates offer to their employees today, right? But these benefits are only used by about 8 to 10% people. They are very important, right? Because people need them. But if you talk about Gen Zs or millennials, more often than not, they would be out of the hospital, right? They won't end up at the hospital. So, and that's a good thing, right? So 8 to 10% of your employees need these benefits, and they're important to have. But what about the rest of the 90% employees, right? So the rest of the 90% employees need benefits which are, relevant for them in their daily lives. Benefits such as, gym memberships, health rewards, mental health, which is one of the most important things to have in your coverage today. Yoga sessions, and so on and so forth. So, you don't want one in 4 employees to not be, mentally fit. You want them to stay engaged. You want them to stay happy, right? And these are benefits that most of your, employees need. And then comes, OPD benefits, which is, doctor consultations, annual health checkups, pharmacy benefits, dental, vision, vaccination, right? These are benefits that most of us need in our daily lives, along with our families as well, right? We don't want our colleagues to end up at the hospital. We want them to stay out of the hospital. So if you see the second part of the slide, right? These are benefits where the larger part of the spending happens, and most of it is today out of pocket. Some organizations have, of course, changed and they are evolving, right? But most of the spending happens here, and this is out of pocket. So some companies are reimbursing employees, some companies are, offering some sort of a solution with some provider, but there is no holistic solution over here. And this is where we feel that there is a gap, and this is the gap that health tech platforms are filling up. Now I'll quickly come to, so most of you would have worked with TPAs, right? You would ask the question, why can't my TPA, do this, right? Why is there even a need of health tech platforms, right? And this is where, the existing capabilities of TPAs, if you see, they're not equipped to handle OPD services or wellness services. They have been structured and built grounds up to handle hospitalization, right? So, their technology is, slightly outdated legacy solutions out there, focused on handling hospitalization, right? The claims process is paper intensive because they have to handle high ticket size claims, right? So TPAs normally, process claims which are worth 80,000, a lakh, hospitalization claims, right? And these claims have to be paper intensive because the severity is high, right? And then, the network is built to support hospitalization. So now if you tell a TPA to handle a doctor consultation, right? Or handle a health checkup, or maybe a pharmacy delivery from a nearby store, right? They're not equipped to do that because, they are structured to build, to process claims which are worth a lakh, 2 lakhs, right? They can't process claims which are worth 1,000 rupees because you can't have a manpower and a paper intensive process to do those claims. And this is where, health tech platforms have come in. So health tech platforms have stitched up, and we are also part of that ecosystem. So health tech platforms have stitched up an entire suite of, offerings which bring cashless OPD services for your colleagues, right? So if you want to offer a dental coverage or a vaccination coverage or say a, annual health checkup coverage for your employees, you need health tech partners for that, right? Otherwise, you can always do reimbursements, but that's slightly the higher side on the cost side. So, what do health techs offer you? So, you get a personal health app, right, which has flexible benefits built in. So, you can offer various benefits. You can offer, different benefits to people above the age of 40, different benefits for people above 50. For Gen Zs, you can offer them different benefits. So you can structure and keep your benefits flexible, right? And personalized. So it's not a one-size-fits-all solution. So I might need something else. My 55-year-old colleague might need something else, right? So that's what health techs offer you. The second is, if you're investing on these new age benefits, you would want health data, right? You would need analytics from your, from your partner to understand your employees' health better, so that you can run targeted programs. And then on the third side is, most of the health tech companies in India have stitched up a cashless network of OPD services. This is a network which goes deep in clinics, labs, pharmacies, dental clinics, and so on and so forth, right? So they also have hospitals, but they try to keep your employees outside of the hospital, right? And that's a key part of the focus. And then one very important thing is the ability to process low ticket size claims instantly, right? And using technology. So you can't have a person processing a 1,000 rupee claim to a doctor clinic, that just doesn't work. And you can't tell your employees to, submit a stack of documents to just get a 1,000 rupee doctor consultation benefit or a 2,000 rupee pharmacy benefit. So this is where technology comes in, and this is where I think most of the health tech players in the country help their HR partners in creating a seamless claims experience, right? Because if the experience is not seamless, no one is going to use these services. So as I said, 70% of your organization needs OPD services, whereas only 8 to 10% need IPD services. This is, of course, a slide of our clients, but it shows a trend in the country today. So if you see, more than 400 plus organizations are now offering 5 million, OPD services to 5 million plus people, right? This is something that is unheard of. If you ask, your nearby, HR friend, they'd say that, they don't have OPD, maybe, some might have, but a large percentage of organizations are now offering these benefits to their employees. So the trend is changing, and this has, companies across the spectrum, companies with 50,000 employees like Oracle, or companies like Axis Bank, which are 2 lakh employees, and then, even companies which are 500 employees, like, or 1,000 employees, like Dream11, Razorpay, and, Apollo, and so on and so forth. So companies across the spectrum are now offering these benefits. They're changing the fundamental structure of their benefits, right? It's no more about hospitalization. It's about much more beyond hospitalization. So I'll just quickly, talk about what we are doing to enable this transformation, and how our take on this problem, how we are solving this problem. So we have developed India's first cashless OPD management platform. Now this is a piece of software that basically sits in each of the doctor clinics, right? So just like you have a TPA software sitting in the hospital, making sure your employees check out within 2-3 hours of their, surgery getting completed, or, on the day of checkout, you need a software at the doctor's clinic or at the lab or at the pharmacy, which can ensure that your employee checks out immediately. So I just walk into a pharmacy, I just get my medicines and I walk out. That's the experience your employees need if you want to bring this as a part of insurance benefits. Otherwise, we are all paying in cash, we all use Paytm or UPI and so on and so forth. So this is, this is our claims management platform, which is there in, all of the doctor clinics. The doctor just needs to, see the patient, give a prescription, and the claim gets settled automatically. So the doctor can see, which is the insurance company from which the customer is, the patient is coming, and they can file their claims and get the cashless authentication done, fully seamless. So we try to eliminate all of the hassles and administrative work, even at the doctor's end. You don't want the doctor to be submitting a stack of bills or prescriptions to you, because they want to focus on their practice. And similarly, you don't want the employee to also be submitting a stack of documents. All for what? a 1,000 rupee claim, a 1,000 rupee doctor consultation, or a 1,500 rupee lab test. So users want an experience which is seamless, similar to, as my co-founder Vaibhav was saying in the morning, we all use Zomato, Uber, and new age apps to consume services, various services which we need in our lives. For health also, there's a need for a digital first solution, and we think that this should be the take on the problem. So I'll just quickly show you some screens of how we are doing it. So this is telemedicine and OPD benefits. So if you see, these are some screens from our app, but if you go to any health tech platform in the country, you'll see similar solutions, right? Of course, with various advantages and so on and so forth. So if you see, the user can just see a list of doctors available, on their app. They can book an appointment with any doctor they want, right? An appointment is generated, and then the employee gets a cashless letter, right? So they just show this letter. It's like a Book My Show ticket, and they can get their consultation done, and they walk out of the clinic, and the claim is settled. So the claim moves from the insurance company to the doctor, and all the employee needs to do is just show this screenshot to the doctor. So that's the seamless experience, of OPD. No need to file any reimbursements. Just book it on your app, show it, and just walk out. This is how you do pharmacy. So you just take a picture of your prescription, select the patient, select your delivery address. You have various providers available over here. That's the job of an aggregator, to bring you all of the providers who can deliver medicines at your home, and compare prices, who can deliver faster, and so on and so forth. And you see there is a wallet, a pharmacy wallet. The cost of your medicines just gets deducted from the wallet automatically. So this is again a cashless pharmacy claim, right? A cashless OPD pharmacy claim. Now I'll move to health checkups, and how you can stitch up health checkups with condition management programs for your colleagues. So employees can just book a health checkup at the click of a button. The data comes in a digitized manner on the app, right? And then you can onboard the employees basis cohorts, right? So if someone has a higher HbA1c, or someone has a higher weight, we recommend them a diabetes management program, or say a weight loss program. And then they can enroll into the program, and they'll be connected with a health coach, with a doctor, their personal doctor, and they can do online consultations right on the app. Again, the most important thing, this is again covered in their insurance, insurance policy. So the employee doesn't really need to do anything. They don't need to pay for these programs. Normally, if your colleagues go for a diabetes management program or a weight loss program, and search for them online, you would end up paying a very hefty amount of money, right? 10,000, 15,000 for such programs, which ensures that not many people, end up using these programs, right? So, and if you as HRs, if you don't offer these programs, then, there's sort of an inertia that's built up. The employee is not going to purchase on their own, and, the health can, over a period of 5-7 years, the health changes, and then, that increases your hospitalization costs as well. So that's, health checkups and condition management programs. And then, if you do all of this, if you change your benefits, if you bring in these benefits, which 70% of your employees are going to use it, you get a lot of data on your employees. Not just data of employees who get, hospitalized, but, a group level data of your population, right? What are the major issues people are facing? What sort of trends are you seeing in your annual health checkups, right? What sort of usage people are doing? What is the top mental health concern for which people are coming and consulting counselors, right? So this is data that you can unlock by changing your benefit structure slightly by deploying these programs. This data is today not available to most HRs. Data for hospitalization is of course available, but this is, an additional thing that you can get. And then you can, change your insurance policy slightly. You can offer various different programs and so on and so forth. So, this is how health tech companies, including us, at Visit Health, are, basically changing the way benefits are looked at. It's just a brand new way of looking at benefits. Benefits should not be only for your bad days. Benefits should also be for your good days, right? So that's, that's the presentation. We have created a QR code, so you can scan the QR code, and you can get access to the application. So you can experience what I showed on the slides. You can experience, yourself as well. You would get a OPD wallet. You can book a consultation, or order medicines and just experience the whole solution. So that's it. We can take some questions if we have time. Time's up.